Good morning to everyone, to Pepe Mejia, who joins us today, to the sign language interpreter and the audience tuned in to this briefing. I would like to start today's press conference by recalling an important date for every Cuban citizen. Yesterday, I did not comment about it because some remarks had already been made by Abdiel. I'm referring to the 60th anniversary of the creation of the Revolution's Defense Committee's CDR for its Spanish initials. Yesterday, September 28th, we Cubans celebrated in different ways this new anniversary as to pay tribute to the legacy of the historic leader of the revolution, Fidel Castro Ruz. Today, we report 7,298 hospitalized patients, 5,536 under medical supervision, 1,221 are suspected cases, and 541 are confirmed active cases. Yesterday, 7,424 samples were processed at the molecular biology laboratories of our country, 2,528 at the Tropical Medicine Institute, Pedro Coury, 963 in Havana's Hygiene, Epidemiology and Microbiology Center, 926 in Villa Claras, and 188 in Santiago de Cubas. 562 samples were processed in the Genetic Engineering and Biotechnology Lab, 420 in Hermanos Amejeiras Hospital, 370 in Manuel Fajardo Hospital, 314 in ICA's laboratories, 311 in the Naval Hospital, 307 in the National Civil Defense Labs, 300 in Fructuoso Rodriguez Hospital, and 245 in the Center for Molecular Immunology. We mention these figures to acknowledge the significant performance of men and women who worked tirelessly for 24 hours to achieve these results. The analysis and processing of these 7,424 samples resulted in 48 people testing positive for COVID-19. This brings the total number of samples processed since the pandemic began to 606,444, of which 5,531, or the 0.91% of people have been diagnosed with the virus. Samples from all of the country's provinces were tested depending on its epidemiological complexity. Pinar del Rio processed 92, Havana 2,792, Mayabeque 279, Matanzas 1,092, Cienfuegos 170, Villa Clara 132, Santi Spiritus 260, Ciego de Ávila 1,617, Camagüey 517, Las Tunas 41, Holguín 351, and so forth from every Cuban territory. The 48 people diagnosed yesterday are Cubans, hence all of them are autochthonous cases. 43 of the 48 cases, or the 89.5%, are confirmed case contacts. This figure therefore means that the 90.9% of all diagnosed cases in Cuba have had contact with someone who had previously tested positive to the virus. The source of infection linked to 5 patients is yet to be determined. Hence, this figure stands at 62 patients over the last 15 days whose source of infection is being investigated. As I mentioned, none of the patients contracted the disease abroad. Thus, the figure of 441 imported cases remains unchanged. 22 patients are male and 26 are female, for the 50.6% and 49.4% respectively. 32 of the 48 patients, that is a 66.6%, were asymptomatic at the moment of the test. The figure stands at 60.4% of all confirmed cases in Cuba up to date that did not present any symptoms while being tested. This is a characteristic of the disease that makes difficult its control. By age groups, 9 individuals are under the age of 20, of which 8 belong to pediatric ages, what stands at 609 diagnosed patients under the age of 18. The 85.1%, that is 518, are discharged and recovered from the virus. 15 patients are between 20 and 39 years of age, 15 between 40 and 59, and 9 belong to the 60 or more years of age group. Of the 48 diagnosed cases, 30 are from Havana, 9 from Santo Espíritus, 7 from Ciego de Ávila, and 2 from Matanzas. In Havana, the 30 cases belong 9 to 10 de Octubre, 4 to Boyeros, 4 to Arroyo Naranjo, 3 each to Centro Habana, Habana del Este, and Playa, 2 each to Marianao and La Lisa. The 2 cases detected in Matanzas belong to the municipality of Cárdenas. In Santo Espíritus, 5 cases are from the municipality of the same name, 3 are from Tahuasco, and 1 from Yaguajay. The 7 cases from Ciego de Ávila belong 3 each to Ciego de Ávila and Morón, and 1 to the municipality of Venezuela. Therefore, Ciego de Ávila's confirmed rate per 100,000 inhabitants continues to be the highest in the country, with 54.23, lower than yesterday. Havana's rate increases to 19.48. Matanzas lower than the day before with 10.14. Santo Espíritus rate increases to 7.94. Artemisa with 3.18, Camagüey with 0.78, and Holguín with 0.2 have slightly decreased their rates. Mayabeque with a similar rate as the day before with 2.86. I highlight that up to date, 7 provinces and the Isle of Youth Special Municipality have remained free of COVID-19 cases for more than 15 days. I will ask Lilian's support to bring up 2 charts. The first one provides information regarding the provinces that have not reported any COVID-19 cases for over 15 days. We have indicated Granma and Guantánamo with 150 days. I stress that these are the actual results, considering that every province accumulates a significant amount of processed samples every day, as has been already mentioned. Santiago de Cuba and Isle of Youth Special Municipality follows with 148 days, Villa Clara with 32 days, Las Tunas with 30, Pinar del Río 22, and Cienfuegos 18 are also among the territories that have not diagnosed any cases over the last 15 days. However, Holguín and Camagüey have presented a positive indicator with 7 and 5 days free of COVID-19 cases respectively. The second chart shows the active cases per province, meaning the hospitalized or admitted patients. These results depend on several aspects, since one patient might remain active for more than 15 days due to the presence of COVID-19 related symptoms or a positive result in the final PCR test applied to the patient. We have Granma with 146 days, Guantánamo, Santiago de Cuba, and the Isle of Youth Special Municipality with 135 days, and Las Tunas with 12 days. With this analysis of the 5,531 diagnosed patients in Cuba up to date, 542 are hospitalized active cases, that is a 9.7%, of which 535, or the 98.8%, are clinically stable. We did not report any deceased patients today, hence the figure of COVID-19 fatalities stands at 122. This means that the island has a mortality rate of 2.2%, lower than the global rate of 3.01% and the regional rate of 3.34%. I always mention the 2 patients evacuated at the start of the pandemic. Yesterday, 79 patients were discharged from hospital, a positive indicator concerning discharged-diagnosed cases ratio. The 79 patients discharged yesterday belong 2 to Artemisa, 42 to Havana, 7 to Matanzas, 4 to Santi Espíritus, and 24 to Ciego de Ávila. Thus, Cuba accumulates 4,866 patients, that is, the 88% of all diagnosed cases in Cuba recovered from the virus. We report 2 patients in a critical state, admitted 1 to Camagüey and 1 to Matanzas hospitals, 4 in serious conditions hospitalized, 2 in Camagüey and 2 in Havana, and 1 patient joined the group of those reported as serious. Concerning worldwide statistics, COVID-19 pandemic remains to be present in 185 countries. 312,207 people were diagnosed with the disease only yesterday, for a total amount of 33,178,045 diagnosed cases. 5,346 fatalities were reported yesterday, quite a significant number, what brings the global death toll to 998,784 and the mortality rate to 3.01%. The Americas region stands at nearly the 50% of all cases worldwide, the 49.68%, with 48,745 new cases diagnosed yesterday, and accumulates 16,485,308 infections. 1,460 deaths were reported in the region yesterday, what accounts for 552,221 fatalities and a mortality rate of 3.34%. The United States continues to top the list of the worst affected countries by the pandemic, with over 7,115,000 COVID-19 cases, followed by India with 6,074,702 cases, Brazil with over 4,732,000 cases, and Russia with 1,151,438 cases. Regarding COVID-19 fatalities, the United States reports 204,756 deceased, India 95,542, and Brazil a higher figure with 141,741. In the Americas region, right after the United States and Brazil, comes Colombia, Peru, Mexico, Argentina, Chile, Canada, Ecuador, Bolivia, Dominican Republic, Panama, Guatemala, Honduras, and Cuba occupies the 21st position, with 5,531 diagnosed cases up to date. This is all the information on the behavior of the pandemic in Cuba and the world.